record, yes. Thank you so much. Thanks, Ellie, for coming to the rescue. So now let me share again and give the floor to Mwape for this presentation. Mwape, are you here with us? Mm,
Yes, actually, I'm very much available. Just waiting for the presentation too.
okay, so is it not shared right now? Sorry about that. Okay, now you should see it, right?
Yes, but not full screen yet.
Here you go. Over to you, Mwape.
All right, thank you. I'm just waiting for it to show.
I can see it already.
Yeah. Mwape, can you see the presentation on your side?
I can't still see it. I don't know if anybody, not yet. And
Uh,
not okay, I can see it now.
okay, great. Go ahead then.
Okay, thank you for this opportunity to be part and parcel of this important program. I'll be presenting on driving patients' engagement in viral hepatitis, lessons learned from Zambia. My name is Mwape Chisonde. I'm the co-founder of Happy Initiative Zambia. Good afternoon, everyone. My patient engagement journey began when my fiancée was diagnosed with chronic hepatitis B. That was in 2013. We were scared, lost, didn't know what to do, and people around us actually didn't even understand what hepatitis B was all about. And as a result of that, we faced silence and stigma. That moment changed my life. I decided no one else should feel that pain or confusion that we went through with my fiancé. And that's how HEP Initiative was born, turning fear into action, silence into hope. Next slide, please. So my presentation basically will cover the background, how we have achieved high patient engagement, policy impact and partnerships, key lessons learned and best practices, HEP initiative highlight and pictures, and I'll conclude. I know I only have 5 minutes, so I'll just touch on the very important point. Next slide, please. So with respect to the background, just to give you an idea, 5.6% of people, that is adults aged between 15 to 59 years old in Zambia, are living with chronic hepatitis B, and 7.1%, the prevalence is slightly higher in people who are infected with HIV compared to those that are HIV negative. Next slide, please. So how have we achieved high patient engagement? So we started with amplifying patients' voices. Just to give you an idea, 80% of our members are patients living with chronic hepatitis B. Their voices guide everything that we do. That's why we made sure that patients are part of every step. We integrated patients from co-creation up to implementation and monitoring of programs. We make our work more inclusive. We created the Help Connect, that is a peer support platform, and we've been able to reach more than 6,000 patients. And this platform provides counseling, expert advice, education, and linkage to care. As of 2024, we managed to organize two key events. That's the Viral Hepatitis Symposium in 2024, that was around July, that brought together policymakers, healthcare providers, World Health Organization, regional and country representatives, various stakeholders, patients from Zambia, Uganda, and Romania to fight stigma and share their experiences. We also managed to organize the World Hepatitis Day, that is in 2024. And one thing that we realized from those key events is that when patients speak for themselves, you get to see change. We use those moments to break the silence and push for change. We also engaged in capacity building. And one thing that I've personally come to understand is that people don't understand the concept behind patients' engagement, not only in Zambia, but in many African settings as well. So through our capacity building initiative, we created awareness, equipped health providers with skills to communicate effectively with patients and treat patients as partners in care. And over 500 healthcare workers, including patients and caregivers, were trained. Next slide, please. So with respect to impact and partnerships, our advocacy began to open doors. Patients' voices are now reaching policymakers. And from where we started from at a community level, we've been able to move to influencing national and regional policies. And partnerships have been a big part of this journey. We engaged the Zambia Parliamentary Health Committee, ensuring that patients' perspectives shape national strategies. I was also privileged to be invited by the Africa CDC Task Force on Hepatitis B implementation guidelines formulation. And I took part in drafting Hepatitis B implementation guidelines for Africa member states. And I leveraged on that opportunity with regards to incorporating patients' recommendations. Next slide, please. So what are the key lessons learned and best practices? So basically, our experience has taught us a few things worth sharing. And the first one is co-designing programs and policies with patients ensures relevancy. Let patients define their priorities. We've also learned that incorporating peer support as a core component is very, very important. And this is what I've observed from a Zambian perspective. I think it's not only a barrier that I've observed in Zambia, but I think it speaks to many African settings as well. And some of the examples are limited awareness and understanding of what patients' engagement means and the weak communications between healthcare workers and patients. And I believe coming up with or establishing a proper structural peer support system can help overcome these barriers. We need to foster partnership with key line ministries, including WHO, CDC, and other key stakeholders to amplify patients' care and support. We need to use data and patient-led experience stories to demonstrate impact, which is very, very important. And we also need to measure outcomes. And on our end as HEP initiative, we track numbers of trained health care workers, engaged patients, and improvement in treatment adherence rate. We also gather feedback through interviews, stories showing improved communication, trust, and patients' involvement in care. Next slide, please. So basically, this is just pictures highlighting our work. These are our community outreach activities that we do under HEP initiative. Next slide. So these are patients engagement forum, which I spearheaded. We organized the first one that was last year in July, where key stakeholders were invited to actually listen to patients' perspective. And it was very, very effective. Next slide, please. So I think from this slide, you can see, I think what the hepatitis day activities. So we leverage on such kind of platform to ensure that patients are effectively engaged and bringing all key stakeholders together. In conclusion, HEP initiative remains committed to advancing patient-led hepatitis elimination in Zambia, but not only in Zambia, but in Africa as well. And we believe, we cannot achieve our goals if we work in silos. We are open to collaboration with global patients engagement community, and we look forward to future collaboration. I genuinely believe that when patients lead, change becomes possible. Thank you.
Thank you, Mwape, for this very inspiring presentation in 7.5 minutes, so almost on time, but that was really amazing. Thank you so much. I will directly go into the next presentation, and hopefully at the end, we can also have a bit of time for questions and answer. So, Emma, may I ask you please to take the floor now?
Course, yeah. Yes, thank you all so much for the opportunity to come along today and share a little bit more about the work that I've been doing at BMJ. And yeah, really happy. I'll try and whiz through this as fast as possible because I'd love to hear your thoughts and questions at the end. If we can go to the first slide, please. So yeah, this is going to be a little walk through our patient partnership journey at the BMJ. So the big kind of infographic on the right-hand side there really showcases all of the ways that we involve and work with patients across the BMJ. Patient involvement in publishing is not the norm, and publishing is a really old, often challenging industry to make change in, really significant change in. But about 10 years ago now, the BMJ decided that we needed to involve patients in all of the work that we did. And that involved having patients as authors, as patients as reviewers alongside our traditional peer reviewers. We involve patients in the governance and in the strategy of all of the work that we do. So we have patients on our editorial boards. We have a international patient advisory panel. And we also ask all of the authors submitting to us how they have involved patients in their work, and really encouraging the co-design of any articles that we publish. And this has taken us a long time to do. You know, I think 10 years ago when we set out to do this, we started really small. We started looking at randomized control trials. Could we ask patients to comment on those? But it's grown and grown and grown over the last 10 years. And that is largely down to the fact that we have had so much support from our international advisory panel. Our editors in chiefs have really got behind this. Our editorial board have been very supportive. And we now also have over 1,000 patient and public reviewers who also work with us on kind of assessing all of our content. So last year, I keep saying we've been doing this for 10 years. Well, technically now it's 11, so I should really be adding a plus to that, because last year we marked our 10 years of patient partnerships at the BMJ, and we launched that by having a patient-led issue. So we patient team took over the issue of the BMJ, and we made it all about patient partnership, which was a real achievement for us and a real kind of success. Talking of success, how do we evaluate it? I think that's really challenging to do in this space. For us, the reason that we do our patient partnership at the BMJ is because we fundamentally believe it's the right thing to do. And we have got kind of processes in place to evaluate the involvement of patients. So we look at things like with our statements, how many of our authors are now reporting that they are doing patient partnership. And just to give you an idea, when we first launched our patient and public involvement statements that we asked all of our authors, about 2% of our authors submitting to us were doing any form of patient partnership. And now when we look at it, it's about 40%. So that's an increase. And although we certainly don't take all the credit for that, we hope that by us having that statement in there, it starts to get people to think about, well, actually, maybe I haven't done it this time, maybe I haven't involved patients this time, but I'm going to think about doing that next time. In terms of our success, like I say, we've kind of grown this sort of patient community. And for us, that's been a real success in that we've been able to embed patients across all aspects of the journal. We fundamentally believe that it makes our content more relevant. We think it makes it more useful. We think it makes it more evidence-based because we can provide that patient lived experience perspective alongside the facts and the figures and the kind of the rest of the research. So for us, we really are very proud of the work that we've done in patient partnership. And something that I would love to see happening more would be more journals taking this on. So next slide, please. So as I've mentioned, for us, making this change towards a patient partnership approach in a journal has taken a long time, and it really has been such a culture change. And for us, this has been a real journey into winning hearts and minds. So for us to win hearts, it's much more about having our editors, our authors really seeing how important it is to hear from patients, hearing those patient stories, being able to relate to some of that lived experience and to hear how important it is that we hear from patients. And that's often done through our patient authored content. We have a series called What Your Patient is Thinking, and that's in there to really give our readers, our authors, an understanding of what it's really like to be a patient and what insights those patients can bring. But we've also had to kind of convince minds. Not everybody in the journal was 100% into this when we started doing this. And so for us, a really important thing to do was to integrate patient partnership into all of our current processes. So when we think about our patient and public review, it was really important for us that it was integrated into all of our traditional peer review processes. We need it to be as seamless as possible for our editors so that they weren't having to kind of trip up and fall down or really struggle to get a patient reviewer when there were so many other things going on. We never wanted our patient partnership to become a barrier to any of our content. So we did a lot of work working with all of our teams, all of our different editors, trying to understand how the processes worked and integrating patient partnership into that as much as possible. We have been, since I joined the BMJ 8 years ago now, we have really moved towards the whole of a journal having ownership of patient partnership. So this is not just the patient team that does all of the patient partnership work. I very much have got to a point where we can step away now, and I'm quite proud to say that I could leave the BMJ tomorrow with my team and this would still continue, because our editors really understand why we do this. They really believe in it. And as I say, it's so integrated now into what we do. We've seen that culture shift, that it's now just usual business to involve patients in all the ways that we do. We also continuously review our progress. We're always looking at impact, and we're always keen to get feedback. And I think that's always got to be a very iterative process. People, things change, life happens. When COVID-19 happened, we had to really pivot our patient partnership work and think about how do we interact with this? How do we kind of adapt? And I think that's again something that's been a real win for us, is being very open to that, being able to kind of adapt as we go. And every year we meet with our International Patient Advisory Panel. We just met with them 2 weeks ago now, and we present kind of where we're up to, and we really encourage them to be critical, to push us, to drive us forward. I think despite the fact that we've made such huge progresses in the work that we've done over the last 10 years, I think we are always keen to be pushed further and to do more. And I think finally, we've always been not been afraid to kind of go wrong or to do something and say, actually, that wasn't right, and we're going to go back and try again. And I think that's, again, another thing that's really challenging in big organizations, particularly in the publishing world, to be open to saying, we're just going to try this. And that's always my one key piece of advice for anyone looking to do this is start small. Don't feel like you need to take on the world. And integrate patient partnership into such a way across everything. Actually just starting small, giving it a go, seeing how it gets on, assessing it, going back, reiterating, trying again, is the biggest kind of tool in your toolbox when it comes to the lessons that we've had in terms of patient partnership. Next slide, please.
And Emma, if I may, I just want to make sure that you get to the end of your presentation, and we only have a couple of minutes left. Thanks.
Of course, this is my last one. So it's very quickly just to say that the Made with Patients Award has given us a huge opportunity more to share kind of what we've been doing to connect with others. We're already in discussion with FMPD about how we might think about exploring this with other journals. And I think that's really helped us with our mission in kind of increasing the patient partnership in journals. So I'd love to see this being done a bit more. So I'm really pleased to have won the award. And yeah, thank you so much.
Thank you. Thank you very much. And let me maybe stop sharing and see if we have. Yeah, I think we still have a little bit of time. Thank you both for sharing your journey. Very inspiring. I don't know if anyone here has questions, comments. Rose, also as a jury member, feel free to chime in and give us your perspective as well.
Well, while others are thinking, I'll say, first of all, congratulations to each of you. These were both amazing discussions of fabulous work. And Mwape, I can only imagine from the start when you were scared and felt stigmatized and silenced, moving all the way into shaping that policy and being invited to those tables where, frankly, patients are often not invited to be able to do the work. So congratulations. I think that is a great example to show people that you can do this even if it seems impossible. So wonderful. And Emma, I've been watching this unfold at BMJ for the last 11 years, and it is fabulous. And the only thing that I will still ask is the question that you asked is why aren't other journals following your example? I have actually asked that of journal editors who have not provided a satisfactory answer. So you keep fighting the fight. I think we're starting to
I
move
think,
already.
yes, I think we have. Hello, we are welcoming our new team. Hi,
Hello.
hi, team.
Hi.
And hi, Isabel. Hi, welcome. Great. Okay, so we are keen to hear from you. I am going to share my screen just to have your presentations here. And as usual, I need to remember how to do that. Give me a second. All right. Okay. This was from our previous room, and here we are. So I think, Isabel, if you're ready, I'm gonna give you the floor.
Yes, thank you so much. You can go to the next slide. So I'm delighted to talk about Eczema Wise, which is our shared decision-making tool and self-management app, both mobile and web. And it is also a research registry that all of which has been made with patients, and we're serving eczema patients and caregivers. Next slide, please. So I will share a little bit of background on eczema so you kind of get the picture of where this app is coming from and why we've made it. And then I'll talk about the patient engagement life cycle soon after. So eczema is an umbrella term for a group of chronic inflammatory skin conditions that are characterized by itchy and inflamed skin and painful flares that are relapsing and remitting. So they come and go. There are 31 million Americans living with this disease and plenty more worldwide. So the need for a tool like this is really great. And self-monitoring is particularly helpful for this disease, especially since there's that relapsing and remitting nature. Self-monitoring can support adjustments of behaviors, lifestyle, and treatment in response to recorded data, either independently, so patients and caregivers just doing it for themselves, or in consultation with a healthcare provider. And in addition to patients, Eczema Wise can be a useful tool for healthcare providers to really see that bigger picture of their patients' eczema, as well as facilitate treatment adherence. And even we've seen it provide documentation for prior authorizations or other insurance requirements, things that we have here in the US that I don't know if you might have worldwide, but it's definitely been a useful tool. Next slide, please. Oh, and yes, I wanted to also bring us back to refine to the goals of Eczema Wise, which are to activate patients and caregivers in their eczema care, to enhance shared decision-making between patients and healthcare providers, but also to advance eczema research through novel real-world data. As I mentioned, this is a registry as well. So we're conducting research based on the data we collect. But on this slide, you'll see what Eczema Wise looks like from the patient perspective. And it allows patients and caregivers to track things between their visits. So that listed there are patient-reported outcomes, as well as treatments and triggers. Patients can save and manage photos. They can prepare for appointments, share their progress with healthcare providers, as well as learn about treatments and get news from the National Eczema Association. So there's a lot really packed in there. Moving to the next slide, I wanted to go over the patient and caregiver engagement life cycle. So we had a little bit of everything actually from the quality of patient engagement criteria. And our implementation of these were based on our various engagement types that we had across the development of the app. And that includes what I've listed on the slide here. So patient and caregivers as advisors before the app launched to really inform the content and design from the very beginning. Patient and caregiver beta testers, patient and caregiver research advisory council that participated in more of those higher level strategic discussions, and patient and caregiver focus groups throughout the life of Eczema Wise, which we launched in 2020, by the way, so it's 5 years old now. And so these patients and caregivers could inform content, design, and just any other unmet needs. So how did we monitor the quality and impact of our engagement? I'll just give some examples. But for, with regard to shared purpose, each group of patients and caregivers were invited to review and comment on the shared goal of Eczema Wise as a self-monitoring and shared decision-making tool. And so with the shared objective and clear purpose communicated each time, we ensured that the patients involved at each of these different levels really felt the shared purpose and that they could also see the outcomes of their involvement. And that in the fact that the app includes patient-reported outcome measures that patients wanted to see in the app, not just that healthcare providers wanted to see. With respect to representatives as stakeholders, capacity and capabilities for engagement, we acknowledge patients and caregivers are experts in their experience with eczema, and so we compensated them, those who engage with us accordingly. We're very intentional also about acknowledging patient expertise with those who engage with us and communicate how we are intentional about selecting for things like diversity in demographics, diversity in experiences, and we ensure that those who engage with us have adequate context, background training, and time to really contribute meaningfully. And we see the positive impact of this in the quality of feedback that we get and in the retention of patients and caregivers in these opportunities. And then finally, with respect to continuity and sustainability, the role of patient stakeholders in Eczema Wise is continued beyond the single launch of the project. As you can see from these different engagements that we list here, we continue to have patients at the table to share their experiences and serve as advisors on the direction of the app. So we're really continuing to check in, listen, learn, and implement based on patient engagement. And this has driven yearly roadmaps that we develop. And we also feel this ensures the app continues to serve the needs of our patient community. Next slide, please. So ending with some key learnings and best practices for successful patient engagement, just at a high level, I'll say patient engagement needs to be early and often. You need to provide patients with the resources they need to engage meaningfully and provide guidance on what you are looking for out of their engagement. And be ready to hear feedback that you didn't expect and be open to pivoting if needed. Just a couple examples. Ensuring patients were part of the advisor group at the beginning meant that we started from a starting point that already brought value to the people who would use the app most, so the patients. And then it does take a little extra time, but developing resources and materials written in a way that patients can understand, giving them time and space to discuss or ask questions, giving clear guidance on the input, it really made for productive relationships and outcomes. And you get sustained engagement. So I'll just end with a few reflections on the impact of the award and PIAF on our work. Receiving the award for this initiative really validated for us that our work is truly important and necessary for the eczema community, and not just for patients, but for all of our stakeholders. It was great to receive it. It's a very visible way to demonstrate to our community that we remain committed to patient-centeredness. So thank you all. I'll hand it over now to the next speaker. Thank you. Is there a question?
And yeah, I see questions. I see hands raised. Olga, can you please hold that thought or maybe put it in the chat because I want to make sure that Tim also has time for his presentation. And then we'll go back to your question if you don't mind.
Okay.
Thank you so much. And Tim, the floor is yours.
Thank you. Thank you very much. Yes. What a hard act to follow. Well, I'm here to talk about Kidney Essentials. My name is Tim Ringrose. I work for a digital health company based in the UK, and Kidney Essentials is a program that we developed with the National Health Service, and we hope it can extend into other markets soon. It'd be great to get your feedback on that. If you go to the next slide, please, Emily. Our Kidney Essentials is a program that one of the first programs that we built, in fact, and it sits on a digital health platform for patients called Healthy Note. And if you can move to the next slide, I can just explain a little bit about the context. Chronic kidney disease affects about 800 million people, close to 1 billion in the world. And like many long-term conditions, it has very few symptoms, particularly in the early phases. And the clinical teams recognize that it can be a great shock to people if they find from a blood test or from a routine checkup that they have a long-term condition that might cause significant problems in the future. And naturally, they want to know what they can do about it. And the unit that we worked with, which was a kidney unit in Reading in the UK, were very concerned that patients were finding it difficult to understand traditional leaflets that were given to patients, and that misinformation online was increasingly becoming a bit of a problem, because naturally we know that patients often will go to Google to look up information. And so they approached us and asked us if we could work with them to build a program to support patients at that stage when they've just been diagnosed with chronic kidney disease. So they identified patients, and we worked very closely with them to understand their ideas, beliefs, and expectations. And the first thing that we did was we built some very simple prototypes online, and we compared those to printed leaflets. And we found that, in fact, people of all ages found the digital information had significant advantages. And one of those is that we're able to use lots of 2D and 3D models and animations to explain things that are really quite difficult to explain with text. And you can see in the video that was rolling some insights on how that looks. But we also found from patients that language was an important thing to also think about and consider, and cultural adaptations. And so after we developed the first program, which was in English, we then set about working with specific communities, and in fact, those communities often have a higher incidence of kidney disease, to develop content that was delivered in different languages and also was culturally tailored for particular groups of patients who have a high incidence of kidney disease. And so you can see some of the differences in the avatar, because we changed the look and feel of the program as well as changing the language. And in fact, for lots of languages like Urdu and Punjabi, providing it in written translation isn't enough. People generally want to be able to hear it, and so the avatar speaks the language in a local dialect. So if you can move to the next slide, please. We were very careful to work out how could we measure the impact of this program. The most important measure that we set out to measure was the impact it has on patients' understanding of their condition. So we used surveys both before and after, and we worked with a university to run focus groups with patients who'd engaged with this. And this is just one of the stats that we found, is that we've had a very high score in terms of people feeling they understood their condition and felt more in control of their condition having used the program. But we also looked at other measures. We know it's important that all healthcare services are feeling under pressure. And so we looked at how digital programs like this could help to reduce waiting times and improve the efficiency of clinics. And of course, it's also important to consider the impact on the environment. And we were able to demonstrate quite a significant saving on CO2 emissions, for instance, by reducing the number of times a patient needed to come to the clinic because our program supported more virtual consultations. And on the next slide, just outline some of our learnings from the program. We found that working with patients right from the start really produced a huge benefit and enabled us to build a program that really catered to their needs and as I mentioned, thought about language and culture and health literacy. We also found that producing this program really helped us to improve the efficiency of the clinics, as I mentioned. And we worked quite hard to integrate the program into the clinical systems that are used. So, for example, when patients were sent a clinic letter, they were sent a text message with a link to the program, and that really helped to build engagement. But as always, there's areas that we need to improve, and we know that we need to look to see how we can improve the number, increase the number of languages we cover, and how we can really work with patients from a much wider range of demographics to really make sure that we are really meeting everybody's needs. And we continue to think about how can we measure the impact of these programs and build on the results that we've had so far. Thank you very much.
Thank you so much, Tim. And congratulations again to you and to Isabel for this work and for well-deserved awards. And sorry, Olga, that I cut you short a little bit earlier. I saw you have this question in the chat for Isabel. So Isabel, would you like to react on that?
Yes. Thank you, Holger, for that question, that multi-part question. I was just reading through it. Yeah. Yes, so having these data on patients and caregivers has really helped our organization. So as I said, we launched it in 2020. So 5 years is still pretty early for a registry to begin publishing, but we have already started analyzing the data, of course, initially to continue to improve the app and understand engagement. And also we've been presenting preliminary research at conferences through abstracts to understand things like people's willingness to engage in a mobile app for self-monitoring, just to understand how this type of tool is received among the community, understanding treatment use, for example, and understanding the relationship between different patient-reported outcomes. For example, there's a flare tracker, so understanding how that corresponds to things like weather and allergens, to really see if people's self-report of flares correspond to the weather, for example. So things like this, we're starting to understand a little bit more about the real world experience, and we're sharing that with the research community and with our patient community. So all of the research that we do is, available and accessible to patients. And so just looking again at your questions. And yeah, as I said, the data, your question, has it turned the needle in any decision making? It definitely has. Like we're an organization. The National Eczema Association is an organization that really prides ourselves on making decisions with data in hand. So yeah, we're understanding how to build our resources better through the data that we've collected from this app. And definitely it is worth the effort for other patient organizations to start collecting patient engagement data.
Great, thank you.
Thank you all for sharing. As usual in these conversations, we want to learn more and more from you guys, but we still have our questions for the co-creation part of the exercise. So we're going to stay together. We have now more or less 15 minutes to really pick your brain, and I'm going to share in the chat the questions that I showed earlier on the slide. And what we would love to hear from you really is, according to you, which kind of criteria should we look into for the next edition? What makes, oh, Rose had to leave. Bye, Rose. But what makes a winner in terms of the criteria of selections? I know we talk sometimes about reproducibility of the initiative, scalability, demonstrated impact, and I love the fact that both of you touch on those points. But also, how can we help those who have submitted and would like to resubmit? How to make sure that we spread the learning? So any idea you have for us in terms of those questions to help us with the next edition? I can, go
I
ahead,
can,
Isabel,
sorry,
please.
I can offer
Oh,
something. So for you all to know, I submitted Exmoise's initiative in 2024 and did not get selected for the award. But I did reapply in 2025 and got the award. But so one point here is you can resubmit and maybe with more time or more data, more evidence of impact, you might be selected. So there's that. But then also this came up in the other breakout room, but it was interesting. I asked for feedback on the application in 2024 and got a response, but it was a little generic. So I think maybe providing applicants with I wanted to hear the criticism. I wanted to know what I can do better for the next application. So I would encourage that, providing people with feedback on what they could do better next time.
mm-hmm. And sorry, I'm taking notes because this is very good for us to hear and to learn. And indeed, really improving the feedback loop has been identified already as something that we want to do, and like concrete ways to do that are also very, very much important. Tim, Olger, anything that yes, more
Yeah.
work for the jury indeed. Go ahead, please.
I was an award winner in 2024 and was a jury member last year. So I experienced both sides of the coin here. And what I really can say and what I gave already as a feedback is that we really need to be more specific what we want to see in the application because, as mentioned earlier, it's probably easy to sort out two-thirds of the applications, but then we need to make a decision who will be the award winner without really having tangible data. It's really, really difficult. And so we must be more specific what should be included in the application and the submission. And this probably, needs to be improved and hopefully will be improved for next year's award.
Very good point indeed. And I heard that from jury members that sometimes applications don't contain enough details, and you guys were obliged to go and look for the details yourself. So indeed, that's a very important point. Tim, you had something to add?
Well, yes. I mean, I wondered if the organization had considered having a stage of interviews, which might deal with some of those issues rather than the jury having to do lots of homework. Why not invite your shortlisted people to do a pitch, and then you can interview them and ask them the questions that you have. Has that been considered?
Um, I not sure it has, but I Sorry, I'm taking the notes as I'm talking. But I really love this idea. And indeed, um, we have floated the idea of having even more co-creation around who gets the award. So having not only the jury, but also members of the community,
Mm.
maybe looking at presentation. So it goes a little bit in your direction. It does alleviate a little bit the jury's work in a way, but also gives the pre-selected persons an occasion to present and to hear questions directly. So I really love this idea. Oh, and I see that my colleague Mafalda is telling me she's taking notes for me, so that's great. I don't need to do both. Thanks, Mafalda. All right. Isabel, yes, jump in.
Yeah, I was just thinking about suggestions for enhancing and spreading learning from
Mhm.
submissions and winners. I just wonder, like, I love having this forum where the winners can get back together and share. But I also wonder if we can, if there can be some sort of forum where winners with the patients they engage can, present or sit for an interview, or if there's a article that can be written, um, to really have the patients and caregivers be part of this share out as well.
Yeah, that's a very good suggestion to go beyond the community of patient engagement champions and really back to the patients. Indeed, indeed, a very good suggestion. Um, I'm wondering as well, and you both, and Isabel specifically, because you had to resubmit. um, Anything we can, in your view, do to encourage submissions or resubmissions, or maybe yes, I don't know. I'm thinking, how can we maybe get more? We saw in the analysis that was shared earlier by Paula, we have more and more submissions from more and more countries, and this is great. But it also means that proportionally, like less people get selected, and we don't want them to receive the wrong message there that their submission was not worth it, right? Because indeed the quality was very high. So I don't know. Any idea around that? You mentioned the feedback loop. I think it's a very important one. Anything you think we should do to make sure that not only you, the awardees, but also maybe the finalists um, get a little bit of the spotlight?
Yeah, I mean, just initial reactions. I did notice that you had finalists that were on the Synapse page.
Mm-hmm.
So, you recognize that there were more than just the winners. So I think that's a nice piece. So, something like honorable mention, or um, recognizing all the people who did submit that just didn't, I don't know, didn't make the cut. I don't know. I thought that was a nice touch. I don't know what else to suggest.
Maybe consider a publication about, let's say, best practices and patient engagement with the
Yeah.
finalists and the winners, so that this information gets more broadly spread.
Mm-hmm.
Yeah, that's a
Yeah,
good idea.
And
publications. Go ahead, sorry.
another idea, maybe encourage the patients themselves to work with the initiative leader or with a champion. Having that thrust come from a patient too could be helpful, in broadening maybe participation, or stimulating resubmission. But I'm not quite sure how exactly you would reach the patient directly. It's a different type of outreach
Yeah,
that's
no,
required.
definitely.
Yeah.
Definitely. But no, I think publications, indeed, it's been on our mind for quite a while now. So definitely a way to help spreading the word and encouraging uh, everyone to apply and reapply. Maybe if I can, because I know we only have 3 minutes left, and you guys seem to have a lot of good ideas, so I'm going to continue picking your brain. But in terms of criteria for selection, I mean, obviously, we talked about the the impact of the work, and I think what really stood out in both your initiatives was the way you really took care of demonstrating that. That's not in all the submissions. I think, Olga, you can agree with me on that. Any other criteria that you think we should incorporate in our selection process? Um,
Mm.
I think in the first step, I think it's probably good to give more advice what to put in the submission, and let's
mhm,
see whether this helps them with the selection process. I think it's difficult. I mean, we had here an example from someone from Zambia who probably had a quite a different health ecosystem than probably the UK or others, and so therefore it's difficult to judge what someone has achieved or what a patient organization has achieved. You always have to consider also the circumstances and so forth. Therefore, I wouldn't put too much,
mm.
um, I would say, selection criteria around it.
I think that's a great point. Giving having a place in in the application to give context and just
Mm.
background a little bit on where the applicant is coming from.
Yeah. No, and
One,
yeah, go ahead,
sorry.
sorry.
I was going to say one thing that's always good to hear from is the end user, the person, the patient. So I think encouraging people to demonstrate, because I think a lot of the time the submissions are written as the advocate rather than as the user, as you know, Loda was pointing out. So hearing the
Yeah,
voice, the patient voice in the application would be good, wouldn't it? We could encourage more of that.
Yeah, that's also a
completely
very good
agree.
point. Yeah,
Yeah.
absolutely. Absolutely. Okay, thank you so much for sharing all these points. And indeed, back to what you were saying earlier, like the Made with Patients Award is a global initiative. So, like, also being mindful of the context and the various barriers that might exist in a context and not in another is very, very important. And obviously, the jury members, although they are very, very knowledgeable, they cannot know exactly what's going on in all the countries in the world. So I think this is also a very important point for us to be able to adjust the selection criteria. And I think we've tried to do that also to make space for the initiatives and the champions that come from places where it's less easy and they're facing more barriers. But yeah, I love also this idea of really contextualizing what patient engagement means in places where, you know, it might not be part of the system at all. So yeah,
Mm.
thanks for sharing this one as well. Um, I see Matt saying 3, 2, 1, go. Let's go back to the main room. Let me tell him that we are ready. And I think we're gonna disappear from here shortly. Thank you so much again for sharing your presentations, Tim and Isabel, and sharing your inputs. Okay, see you in the main session.